Hi, I'm Dr. Robert Glatter, medical advisor for Medscape Emergency Medicine. Joining me today is Dr. Ryan Marino, an emergency physician, medical toxicologist, and addiction medicine specialist at Case Western Reserve University School of Medicine. Welcome, Dr. Marino. It's really a pleasure to have you join us.
Yeah. Hi, Dr. Glatter. Thanks for having me.
Today's topic will be the toxicity of liquid nicotine, and it's something that's been very important, especially since the CDC put out a report several months ago looking at the cumulative exposure from 2022 in the mid-year toward 2023 and looked at the number of exposures, and there were nearly 7,000. But the thing that caught my eye was that almost 90% of these exposures were children under the age of 5, which to me was a significant wake up call. I know that the proportion of children exposed to liquid nicotine has been increasing, but this is something that really seems like a real public health concern, if not emergency. I wanted to get your take on this report and have you just jump in on this.
Yeah. So this was a report based on poison center calls. And so I think a couple things to mention here is we've seen exposures to nicotine and calls to poison centers about nicotine increasing pretty steadily over the past number of years. But this is a pretty significant increase, even kind of year on year. And I think this correlates to kind of the liquid nicotine and vape market that we're seeing in this country. But one thing that I do want to mention too about this data is that because it is poison center data, people have to call this in. And so it's self reported. So it's probably an undercounting, an underestimate of actual nicotine exposures. And so the real number is probably going to be even higher than what we're seeing here.
What are the signs and symptoms that a child has a significant exposure? What are the things you look for? What's the history that you elicit? How do you approach such a patient, pediatric patient?
The most important thing is if someone reports that they think their child was exposed to nicotine, that's going to be the best clue to clue you in because the symptoms can be non-specific. And so early on, I mean, you can get pretty mild symptoms. The most common presenting symptoms that you would especially see, I think, in the emergency department are going to be GI symptoms, nausea, vomiting, diarrhea. And you can get kind of a sympathomimetic looking picture, like adrenergic stimulation with tachycardia, hypertension, diaphoresis, those kind of things. But we really worry because this can progress to things like bradycardia, hypotension, depressed level of consciousness, even coma, and respiratory failure. Kids can get respiratory paralysis from nicotine poisoning, kind of on the far end of the spectrum.
So with the liquid nicotine, with the vial itself, certainly, if you ask a parent how much do you think your child might have been exposed to, what's a quick way that you estimate this? In a child, say, who vomited once, looks okay clinically. What determines whether you'll observe that child for another 4 to 6 hours? I mean, how are you determining the degree of exposure in terms of milligrams of nicotine?
Yeah, so that's a good question, and it can be really tough. I don't know that there is necessarily a good answer in terms of the exact dose and kind of correlating to symptoms. And this is something that is still kind of debated in the literature, even. But we tend to think of for like a small child, a toddler, um, ingestion of like one cigarette would merit observation for at least several hours, and a cigarette would be probably like 12 milligrams of nicotine that it can contain. And the liquid nicotine in vaporizer products and like refill cartridges and those kind of things can have up to 20 milligrams per milliliter of nicotine. So very small amounts can contain significantly more than even like an ingestion of a cigarette that we used to teach. And the unregulated products can have even more than that, can be more concentrated, and that's something that is not seen infrequently. So that does make it more concerning with this liquid nicotine exposure. But anyone who's symptomatic, I think, has kind of bought themselves at least a several hour observation in the emergency department, and 6 hours is probably the general cutoff. But certainly with a low threshold to admit for significant symptoms or any sort of signs of progression. The one, I guess, good thing about nicotine, which maybe is not a good thing either, is that it is pretty rapidly absorbed and should have pretty rapid onset of effects after ingestion. So it's not like you would be expecting significant delay in your presentation or progression of symptoms. But again, because it is very rapidly absorbed, there's not really much time to intervene before it can get into the body.
And that raises a question too, which you're discussing in terms of absorption, gastrointestinal versus inhalational. So if a child puts his mouth on a device, takes a few puffs, how concerned are you in that scenario versus a child who actually ingests liquid nicotine?
The inhalation is definitely less concerning, and not to say that it isn't a concern or that you can't have significant toxicity, especially in little kids. But that would be a lower risk for toxicity, and you would usually get a lower potency or lower dose exposure that way. Whereas ingestion of the liquid, because it is so concentrated and is so rapidly absorbed from the stomach, uh, is much bigger risk. And usually, I mean, these are going to be flavored to taste good too. So those little bottles of kind of the refill nicotine liquid can contain quite a large doses of nicotine, that a small child might just ingest the whole thing.
I wanted to ask you also about dermal exposures. Certainly, it's a concern with farmers that are in the tobacco fields, but children that get a hold of liquid nicotine, it spills on their hands, and they rub their face and so forth. How much of a concern should parents or caregivers have about that aspect? And maybe you can talk about absorption through the dermal route.
Yeah, so unlike a lot of other substances, nicotine is very readily, rapidly, completely absorbed through the skin. And so, certainly, this is historically described in tobacco farmers' green tobacco sickness, where they would get significant toxicity just from harvesting the leaves and getting the liquid on from the plants onto their skin. But when it comes to the concentrated nicotine fluid, this is much higher doses of nicotine in much smaller amounts of liquid. And so this is definitely something that is a concern. Adults can get toxic effects from skin exposure. And so while I haven't personally seen any children with this, I have to imagine that this is a concern for children because they're much smaller in size. They have much larger skin area, and any exposure to that kind of dose of nicotine, which would be very, very quickly and rapidly absorbed, could be a big risk. So I think parents should also keep that in mind. Even if it just gets on their skin, it's worth calling at least poison control and keeping a close eye on them.
How soon would you expect to see symptoms after a significant dermal exposure relative to, say, an ingestion?
So it would probably be a little slower than an ingestion, but still would be within like 1 to 2 hours where you would expect to have some symptoms. But in this case, I mean, if you give poison control a call, they can tell you what symptoms to watch for. They can check back with you, maybe keep you out of the emergency department, that kind of thing. But certainly within 2 to 6 hours, you should have some sort of symptoms from any exposure, including dermal.
Right, and that's what brings me to another point that you're bringing up here is how children are enticed by this, the marketing, especially the flavors, the packaging, the colors. They're very, they grab you, and they grab children more so in the sense that they want to pick it up, put it in their mouth. Often they spill it, but they'll get some amount ingested or maybe even inhaled if it's a device. So in terms of legislation, in terms of child-resistant packaging, 2016 saw the advent of some legislation by Congress, but it wasn't complete. Though it didn't really speak to the devices themselves. It talked about packaging and legislating packaging, but it didn't go quite far enough. And I want to get your comments on that.
Yeah, so I mean, I think that kind of packaging and safety is definitely beyond kind of my area of expertise. But in terms of things that we've seen, when you do have kind of a less secure packaging and more kind of child friendly, colorful, enticing things, which adults also like those things. Don't get me wrong. That's how you sell a product.
Sure.
Um, but that does lead to more exposures. And so, I mean, we've seen this definitely in kind of like the edible THC market, where if you have edibles that look like regular candies, are brightly colored, have cartoons on them, you have more children eating those than if you have just kind of nondescript white packaging. And so the best thing, I mean, would have these be out of reach, insecure locations, but the packaging does definitely make a difference, and this is something that has been borne out over and over in the literature. So I think any way that we can kind of minimize the risk to children there is definitely worth at least looking into, if not going forward with kind of from a legal perspective.
Yeah. And also in terms of safety, if parents would lock up their vape liquids and also their devices, that might even go further. And I think, this is something that any caregiver parent needs to keep in mind when there's children in the home.
Even if it's not just the parent or caregivers, given the popularity of vapes and these different kind of vape products that are on the market now, knowing that these are going to be around, I mean, even if you're in public, there's a good chance someone could have it sitting out on a table at a restaurant. We see these things like the elf bars, I mean, are very brightly colored, and the kind of single use vapes like that at least have less of a risk for kind of the liquid being an exposure, or anything getting out of them other than kind of inhalation. But still, that is something that's going to entice children. These are things that I see out when I am out in public as well.
So, when you're looking at a child in terms of sensitivity of symptoms, would you say that vomiting is the most sensitive or even specific way to note that there's been a significant exposure, assuming no other symptoms have occurred, especially, for example, a seizure?
In terms of kind of the your presentation, without having some sort of at least reported history of vomiting, I would have a hard time convincing myself that a significant nicotine exposure had occurred. Certainly, a large volume exposure may progress more rapidly, but usually there would at least be some report of vomiting or GI symptoms prior to coming to the emergency department, if
Hmm.
not on presentation.
So, in a sicker type patient that comes in post in terms of ingestion, altered mental status, and then gets bradycardic, their airway may be at risk, and say they require intubation, is there any role for charcoal or even gastric lavage based on presentation in terms of severity?
That's a great question. And I don't know that this is like a 100% definitive answer, but given that this liquid, the nicotine liquid formulations are usually so quickly absorbed, there probably isn't much of a role, um, and beyond kind of supportive care, especially if you're concerned about kind of mental status or airway issues and any vomiting. Charcoal would probably be contraindicated in most of those situations.
Hmm. So essentially, supportive care and obviously airway management would be front and center in any patient that we approach. Are there any other considerations, any nuances or pearls that you can give us in caring for children in the general sense that are suspected for an exposure?
I mean, I think the main things beyond kind of just supportive care is knowing that this is something that can progress rapidly. It's something that is very rapidly and readily absorbed, and that a child that is well appearing appears very maybe stimulated or having kind of hyperadrenergic vital signs early on can progress to kind of the opposite, to kind of coma, shock, and more concerning features. It is acting on your acetylcholine receptors. If you just remember, kind of cholinergic toxicity is something that we worry about a lot. And so we don't see organophosphate poisoning really ever in the United States anymore. But everyone remembers, I mean, I think from like step one, the killer bees, this is a poisoning that is a big problem. And so nicotine, I mean, can progress to very much the same kind of features. And so just remembering that it's nothing to sneeze at.
Mhm. Is there any role for atropine or even pralidoxime in terms of management of the critically ill child that's poisoned?
Yeah, I mean, I think certainly in terms of kind of treatment of bradycardia, hypotension, reaching for atropine is reasonable. And if you have any concern about kind of like secretions, which you shouldn't see necessarily the same kind of bronchuria from nicotine poisoning as you would expect from organophosphates, but atropine in terms of hemodynamic support is a reasonable choice.
Do you feel that that other organizations, especially emergency medicine organizations, need to pick up the ball and really sort of shout louder about this public health danger?
Yeah, I definitely would agree with that. I think this is something that most people are not aware of. And even with kind of the popularity of vapes and the prevalence of nicotine products, which seems to be increasing, as well as the dramatic increase in exposures, for the most part, I think people who use these products and people who have small children are unaware of the fact that this is a significant risk, and how kind of risky those concentrated nicotine fluids can be.
There has been some concern about the metals that, especially in terms of first generation vapes, in terms of the metal coil having some leaching of chemicals, including nickel, cadmium, zinc, manganese, chromium, really dangerous, potentially carcinogenic chemicals, other than, say, acetaldehyde, formaldehyde, and so forth. How much of a concern do parents, or should they have, upon you know, an inhalational exposure or even a liquid nicotine exposure in that sense to a vape pen?
The metal concern it is significant. This is probably going to be a bigger issue for people who are using these chronically, but the inhalational exposure is the most concerning kind of route of exposure for most of those substances that you listed. And certainly things, I mean, like manganese and cadmium cause pretty profound and very difficult to treat forms of toxicity. So anyone who's using any of these kind of older products or unregulated um, vapes from kind of international markets should be aware of that. It's probably less of a risk to like children who maybe get a couple puffs or something by accident than the nicotine, but it's definitely also something to keep in mind because it is a concern and we want to minimize that. There's no good amount of kind of those toxic metals that I can really think of that I would want anyone exposed to.
Absolutely. Do you feel that convection based vaping devices, as opposed to conduction based, might have a role in mitigating some of the dangers in this regard?
Yes, that is something the market has been trying to kind of regulate and improve on. But again, seeing the fact that older and different products are still out there and they can be obtained from other places as well is something that is concerning.
Okay. Well, this has really been great information. I appreciate you sharing this with our audience. Again, thank you for your time and your expertise. And it really is quite an honor to have you join us. Thank you again, Dr. Marino.
Yeah, thanks for having me.